I performed a fellowship for glaucoma surgeries and anterior segment surgeries in New York at Columbia University. And then I really loved my time there. I helped train residents and staff them in the ORs, and I really loved the teaching aspect of things while I was up there. And I love to continue to give lectures at the universities. In today's world, fellowship training is very important because it gives you higher level expertise and experience of seeing more complex cases, being able to handle a wide spectrum of surgeries. During training, both at Columbia and George Washington University, I did trips overseas to South America, various countries like Ecuador, Guatemala, where we did a lot of surgeries down there. The patients are very thankful. It's a really great opportunity to make a big impact for people who don't otherwise have access to care. And you also see a lot of pathology and do a lot of complex surgeries that aren't as common in the US, where people have more immediate access to healthcare. So I think doing those sort of projects and trips overseas was another thing that really drew me to ophthalmology, and I try to do it periodically when I get time. It's a really rewarding experience, and also just good to hone various skills that you may not use as often here in the US. I've been fortunate to take care of patients on a wide spectrum, both from in my training years at the universities, but also overseas doing mission trips and whatnot. One case that is particularly memorable was actually a very unique scenario where a patient had a very complex cataract surgery done overseas. It was actually done in Ghana. And during the surgery, because it was a very advanced case, they just had to abort the surgery and suture close the eye. And the patient then got on a plane and came to Washington, D.C., where I saw them in the emergency room. And they had a only partially completed surgery. So we had to go straight to the emergency OR at the hospital and get the remaining cataract out and help this patient eventually get a lens implant later. And that patient was forever thankful that she was able to come and get the surgery done and ultimately get vision back.